Hi, everyone. Thanks for joining us today for our webinar on Medicare. Today, you're going to be hearing from myself, Scott Warner, as well as Taj Pereira. Here's our agenda for today. Medicare is a large topic. The details of Medicare go well beyond what we're going to cover today. Our goal here is to kind of point you in the right direction, talk about some key events and dates, some common claiming strategies for Medicare, and then we're going to direct you to some outside resources. So Taj is going to talk about enrollment periods and eligibility today. I'll talk a little bit about benefits and coverage and common claiming strategies. And then Taj is going to hop back on and talk about directing you towards some experts that can give you some guidance on enrolling in Medicare.
Thank you, Scott, and I hope everyone is having a great day, and thanks for listening in today. First big question that everyone has is where do we get started and how do we get started when it comes to enrolling in Medicare? Um, First thing that everyone is going to want to be aware of is really just when you want to enroll, right? If you're still on your health group plan through employment and you're working past age 65, that's another discussion. But first thing, if we are going to be enrolling at 65 for Medicare, which is your eligible enrollment date, is that first 3 months prior. So that's going to be called your initial enrollment. Like it shows here, it's going to be 3 months before your 65th birthday. And that is when you're going to sign up for Part A Medicare and also Part B as well. And that's really important because we want to make sure you avoid any kind of coverage gap between your group health insurance you have with your employer and when your Medicare does start for you. If you do enroll 3 months prior to your 65th birthday, your coverage date will start on the first of the month on the month of your birthday. For instance, if your birthday is in April, you can start enrolling in January. Your coverage will start April 1st if you complete enrollment. With that as well, you also do have your your open enrollment every single year. Once you're on Medicare, you can modify coverage starting on October 15th, ending on December 7th, and then that first date of coverage will start on January 1st. It'll be very similar to what you may have through your benefits coverage through your group health insurance plan on open enrollment every single year. If we do miss the initial enrollment coverage, you also have qualifying events that can get you enrolled into Medicare. First big one is if you do retire after age 65, that is a qualifying event, or you lose your employer health insurance. That can be from, termination, leaving your company, or if the company ends their health coverage for employees. With that, with the qualifying event, you do get access to the same benefits without penalty. The qualifying special enrollment does last for 8 months from that event. So you do have from that time period of when you have that qualifying event, 8 months out to have that special enrollment period to enroll. And one important thing is you want to make sure that you stop your contributions and any employer contributions to your health savings account, also known as your HSA, 6 months prior to coverage start in Medicare to avoid any penalties since you cannot make HSA contributions while you are enrolled in Medicare. One last thing to think about as well is when it comes to your Part B enrollment. This is something where you can opt out of if you don't want to have Part B coverage. This can be for a slurry of reasons. Maybe you still have it covered through a benefits package at work, or your spouse is still working and has coverage and you don't need Part B. Just understand that Part B will have a penalty, a 10% premium for every year you don't enroll past age 65 or when you enrolled in Part A. The general enrollment for Part B will occur from January through March of every single year, and coverage will start July 1st. Perfect. And then again, for big eligibility requirements, obviously you do have to be a US citizen or have been a legal resident for at least 5 years. You do need to be at least, 65 and older, like I have mentioned, and you or your spouse has to be fully insured, which means working for 10 years or earning those 40 quarters, which you can earn 4 quarter credits a year, which is 10 years total for Medicare covered employment. Now, Scott will take us through the different benefits and coverage when it comes through Part A through D Medicare and the different types of coverage associated with those.
Thanks, Taj. All right, everybody, let's get into the benefits and coverage here in Medicare. We're going to start pretty high level, and then we'll get down into some more detail and try and help you figure out what's going to work best for you and your family. So I'll just give you a moment here to take a look at this slide. Down here on the left, we have basic coverage options. Over on the right, you can see Medicare Advantage and supplemental insurance. Those are going to be, like it says, additional coverage. And if we jump back to basic on the left, we'll look at Part A. This is going to be inpatient care. If you need to be in a skilled nursing facility, or need critical care in the hospital, Part A is going to be the coverage that's going to pay for that. Part B, this is going to be your medical insurance, which was going to cover outpatient care, preventative services. It'll help you cover the cost of certain medical equipment. And then Part D is prescription drug coverage. Prescription drugs can get very expensive. Part D is there to help kind of mitigate those costs. The important thing on basic coverage is that all these costs are predefined by the federal government. Part A is free for most people as long as you're eligible for Social Security. Part A is going to be free. Part B is going to be your most expensive premium. And that really the reason there is that's going to be the premium for your basic medical insurance, and that's also going to be tied to your income. So if you have income over certain thresholds, there'll be additional premiums that are going to get charged there. And then Part D is just going to be a small premium increase to what you pay for Part B. And then if we jump over to additional coverage, there's two options here. There's Part C, also known as Medicare Advantage, and then Medigap, or supplemental insurance. So there's four names that you get to remember for additional coverage. Lucky you. These are similar. The important thing is that you can only choose one. So Medicare Advantage is going to bundle Parts A, B, and D with vision, dental, and hearing. Medigap is going to bundle Part A, B, and D, but it's not going to cover vision, dental, or hearing. You can't choose both. You're going to have to choose one or the other. We'll talk a little bit more about some similarities and differences here. Similarities, they're both private insurance options. They both contract with the federal government. The goal here for both is the same. It's there to limit your out-of-pocket costs. With regular Medicare, there's still going to be deductibles and copays. And then there's going to be unlimited coinsurances, which can really run up if you don't have additional coverage. Now let's talk about some differences here. You can see the group of bullet points down there at the bottom of those boxes. Medicare Advantage is non-standardized. What this means is that the plans are going to be different based on regions of where you lived and what provider networks there are where you live. On the other hand, Medigap is standardized. There's 10 options. Those are going to look the same no matter where in the country you live. Like we just talked about, Advantage is going to offer in-network coverage. Medigap is going to cover any doctor that accepts Medicare. We talked about how the plans are bundled. And then really a good way to think about the difference between these two is that Advantage is going to offer you a more broad coverage. The trade-off is you're going to have a higher potential out-of-pocket risk. Medigap is going to have more extensive coverage, but it's going to be on a more narrow scope. Another important point here is that these are opt-in options. These aren't mandatory. Most people do opt in to one or the other, but these are not a mandatory option for you in Medicare. So natural question, if most people choose one, what's kind of the decision there? So let's talk a little bit about that. Like I said, most people opt for Part D, and most people opt in to either Advantage or Medigap. So what's going to be most important for me? So if the ability to see any doctor is important. If you do frequent traveling, so you're going to be kind of out of your provider's network area, um, then Medigap is probably going to give you a better option. Another big important thing here is if you have a pre-existing condition that you know is going to run up pretty significant medical expenses, you're probably going to want to get Medigap, make sure that issue is covered. On the other hand, if lower premiums are important to you, you like the network, you like the provider network in your area, it's familiar to you, you want to have vision and dental and hearing all bundled in one plan, then the other option is Advantage. So now let's talk a little bit about how we are assuming costs for Medicare in the financial plan. Now, if you draw your eyes to the top of the slide here, this is a fictitious financial plan for Bob and Jane Test. This is not a client. This is all fictitious information. The inputs here are going to apply to kind of a broad range of what people on Medicare will expect. This information is updated at least once a year by our financial planning software. And then on an ad hoc basis, if there's big law changes where Medicare costs are going to be affected, then the financial planning software will go in and update these kind of base cases. You can see down here on both Bob and Jane's cost assumptions, the software is assuming all the costs. So it's assuming Part A would be free if you're eligible for Social Security. So assuming Part B cost, Part D, a Medigap policy, as well as additional out-of-pocket costs. And it's doing that for both Bob and Jane, and then adding them up together for that annual medical expense in the financial plan. Okay, now I will hand it back to Taj, and we'll talk a little bit about how to get expert advice here for Medicare.
Perfect. Thank you, Scott. Before we jump into resources for expert advice too as well, we want to make sure we give some pointers when it comes to different life events as we approach Medicare age. First thing we want to think about, right, is for those pre-retirees or those pre-retirement ages, really important to take advantage of your dental and vision coverage through your group health employer plan. Normally too, you're going to have much better coverage through your group insurance plan for dental and vision. So make sure you utilize that before you get on Medicare or leave your employer. And also get services done, get drugs done pre-retirement while you're still on that group plan as well. So definitely take advantage while we're dwindling down to retirement age. A lot of people may be on this webinar as well thinking about, I'm retiring, but I'm not 65. What do I do? I'm going to lose my health coverage through my employer. And that is a fair question. And two things to think about is either getting on COBRA or the Marketplace, also known as the Affordable Care Act. COBRA will extend coverage to yourself and your plan dependents based, you will have different month coverages based on if you were the employee and if you were the dependent of the employee. And that's something we can discuss. So you want to compare costs, your health issues and networks when it comes to having COBRA insurance, which is extending your employer's plan essentially, or getting onto the Marketplace and paying via the Affordable Care Act. And then lastly, at retirement, some things to think about, right, is that potential increase in your Part B and D premiums that Scott mentioned. Is that fancy acronym called IRMA, also known as Income Related Monthly Adjustment Amount. Like Scott had mentioned, if your income is above a certain threshold, you will have increased premiums to Part B and D. And that is something as us advisors and many clients may be listening to this that we discuss with you guys and making sure we stay under that amount. But it's important you're aware of it while we're in retirement in that Medicare age to make sure we're not increasing our premiums or limit that ability as much as possible. Lastly, as well, is having a trusted contact on file. I think this is really important. Share your plan with your family, your transportation plan, especially when we get less mobile into our really older ages. Make sure they know what to do, what you want, your wishes as well. Making sure you have a good plan around that too, so they're well informed as well as your advisor is well informed on your plan moving forward. And then lastly, for that expert advice, we do love this one company called Health Pilot. They are online, extremely transparent when it comes to giving expert advice. They are licensed in every state across the US, so all of our clients are able to use this services. There's no commissions, so they're not incentivized to push you into any certain policy, and we wouldn't feel comfortable with referring you guys to anybody that would do so. So they're a great company to work with. Their cost is baked into the insurance policy, so it doesn't cost you anything to discuss with them or use them to help you get that expert advice. Um, and you can see there how it works. This is a large pool of educational resources for our clients. Great tool to decide whether you are ready for Medicare, to get on Medicare, discuss different options and pros and cons, like the Medigap policies versus traditional Medicare as well. And lastly, to round us out, to put a bow on everything, is use us as resources as well. So these webinars will also be on our ACM website. Please contact us, your advisors here at Aspen Capital. We would love to have conversations with you guys, making sure we have a strong and solid plan and making sure we can work with you to make sure you're comfortable with this transition period in your life. But myself and Scott, we want to thank you all for listening, and we look forward to discussing further in meetings.